Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease. Each one of these webinars is different because they're created by your questions. So I'm interested in seeing what you have in store for me tonight. For those of you that are returning, I see a lot of familiar names on my message board. Welcome back. I'm glad to see that you keep getting value out of this and that you keep returning. For those of you that are new here, welcome. For those that are new, there's a couple ways you can participate, and actually for those returning too, but let me explain to the new people how you participate. One, you can listen to the questions as I read them that people write and see how I respond to those questions. There's always some good learning that takes place that everyone can learn from a different person's question. The other option is to actually write a question to me. And especially if this is your first time, that would be a bold move, but I welcome bold moves here. The way you do that is on the right-hand side of your computer is a chat box on the bottom. And you write your question to me using that chat box. The only thing I ask is that you do not hit the enter key to try to create paragraphs. Every time you actually hit the enter key, that sends the question to me. And it gets hard if you send your full question in multiple parts to me for me to be able to follow from this side of the computer, all right? The other thing is this forum works best for shorter questions, not your whole life history questions, okay? So if the questions get to be too long, I just won't be able to answer them. Sometimes I post them up first and then I start reading them. I think this is too complex for this type of a forum that we have here tonight. The other thing I want to let you know, we've got over 200 people have signed up for tonight. Now, not everyone will be here, but that's a good audience. And with that, it means I'm not going to get to everyone's question tonight. I don't show any preference in who I take, so just so you know, but I may not get to all the questions, all right? So I just want to warn you about that. And then finally, I am, as usual, creating a recording of tonight's webinar. You will get an email from me tomorrow morning announcing that that recording is ready to be viewed. And basically this evening, I've got to do some minor editing of the video and get it and get a synopsis written of it and get it posted up to YouTube. So after the webinar is over, I still have more work to do. But look for that email tomorrow morning. And when you get that email from me tomorrow morning, there'll also be links that you can use to sign up for next week's webinar. Realize that we actually have 4 webinars in a row now. All right, so we've got a number of visits we're going to be doing here. Next week, actually, when we host the webinar, I'm going to be calling in from Colorado Springs, where I'll be visiting my 92-year-old dad. So it'll be a little bit of a different setting in back of me, but still the same webinar, okay? So one last thing, during the webinar tonight, if you are participating in the live version, the questions, as I read them, I actually post them and you can see them on your screen. The reason I still read them, though, is that in the recorded version, the questions don't show up, okay? So I am going to read them out loud, but you'll be fortunate in the live version that you're going to be able to actually read those questions yourself too, okay? All right. So without any further ado, let's go ahead and get started. Let's take a first question here tonight. First question is from Alex. Let's see. Hi, Dr. Ross. My Lyme mold doctor ran some HLA tests and a specific gene popped up, DRA16, which he sees in Borrelia infections. Have you used these lab tests to determine Lyme infections, or have you heard of this test to determine if a patient has Lyme? He ran an HLA LabCorp test to see if I'm prone genetically to mold toxicity, which came back and stated that he wasn't sure due to my results not showing the sequencing he normally sees with these tests of patients. Are these tests accurate to determine if you are prone for mold toxicity? Any thoughts or perspectives would be appreciated. Okay, so yeah, we got to look at that with you. So HLA testing is a type of genetic profile. It's not your whole genetic profile, but it's just a specific type of genetic profile. And what we use it, we tend to use it more for mold toxicity. We can tell by the gene sequencing whether you might be somebody that is susceptible to mold toxicity or not. What I will tell you is having a genetic profile does not mean you manifest the problem, right? So think of your genetic profile as your blueprint, and then there's what happens in you. And between your blueprint and what happens in you is a lot of stuff, okay? So for instance, one factor, for instance, is yes, you could have a genetic profile that says you're going to have a hard time removing mold toxins, but guess what? We have 90% of the genetic material in our body is actually not ours. It's from our gut microbiome. It's the germs that live in our gut. And one thing that the gut microbiome does, it does a lot of things, but some of the things it does is it can remove toxins. So when your mold toxins circulate through the intestines, and they do, maybe it's the bacteria in your gut and some people that take care of it, okay? The other thing I would say from a mold toxicity standpoint is it is true there's a genetic profile that may make you more susceptible, but I have also seen people that had negative genetic profile testing that still had mold toxicity issues. And I determined they had mold toxicity issues by measuring the actual level of mold toxins in them using a urine mycotoxin test through a lab called Real-Time Labs, okay? And so a genetic profile doesn't tell you whether you have the condition. It just says you're a setup. And between having a setup and manifesting are many different steps. And even if you don't have that genetic profile, it's still possible to get mold toxicity, for instance, okay? Maybe a little bit harder, but you can still get it. Right now, the HLA profile for Lyme he's talking about would only indicate whether you might be susceptible to getting Lyme, but it tells you nothing about whether you actually have the germ in you, whether your immune system has fought it. So it's not an accurate way to diagnose Lyme, okay? Having a profile doesn't mean you have the condition, okay? The best way to determine if you actually have Lyme infection or Babesia infection or Bartonella infection is a newer type of test that has been developed over the last few years by the lab system called IGenex, and that is their testing technique called an immunoblot. So whenever we look at testing, we're looking to see how sensitive, how good is that test at picking up if you have the condition. And there's something called specificity, which says when your test comes back negative, is it really real? Okay. And IGenex has this immunoblot is much better than any other testing technique out there, even Armin Labs ELISpot and Infecto Labs ELISpot, because when they do this immunoblot method, they're looking to see has your body had an immune reaction against the germ. For Lyme, they look to see if you've had an immune reaction against 8 strains of Lyme, versus Infecto Lab only is checking for 1 strain. And Armin, I believe, is looking for 2 or 3 strains, but not all 8 strains, okay? The other thing, and for Bartonella, IGenex is looking to see if you have a reaction against the full family of Bartonella, which includes the 15 kinds of Bartonella that can infect you, versus Infecto Lab and Armin Labs ELISpot test only looks against 1 strain called Bartonella henselae. And for Babesia, the immunoblot through IGenex is looking to see if you have an immune reaction against the full family of Babesia that may include 15 strains that can infect people, versus both Armin and Infecto Lab are only looking to see if you have a T cell, a white blood cell reaction against 1 strain of Babesia called Babesia microti. So your best and most accurate way from a lab standpoint to determine if you have Lyme is the method called an immunoblot, using immunoblot for IgM and IgG antibodies from IGenex, okay? Now, I know I often get asked, well, what about Vibrant Labs and what about DNA Connections? And what I want to let you know is both of those labs have not sufficiently validated the accuracy of their testing. They just haven't. So when I get results from those labs, I often think they're erroneous because they don't match what I'm seeing in my patient, basically. And so although they may be less costly, you get what you pay for, okay? Now, there is a whole article I wrote about the best way to test for Lyme, Bartonella, and Babesia. I'm going to show you that article here in a minute. It's a video as well as written article, which goes through a lot of this in more detail. But I would never make a diagnosis of Lyme based on a genetic profile test. And again, for mycotoxicity, having a positive genetic profile doesn't prove you have the illness. The more accurate way is to see, do you actually got mold toxins in you? And that's that urine test I was telling you about. Okay. All right. So let me just do a quick screen share here. All right. So let's see here. All right. So this is my Lyme information site called Treat Lyme by Marty Ross MD. As most of you know, the meat of what is in my site is under this tab called the Online Lyme Guide, okay? Under here, you can find anything I've ever written about Lyme disease. I probably have covered most topics related to Lyme disease. So in terms of looking at testing, take a look at the section called Tests. And the latest article I wrote about testing is this article called The Best Lab and Test for Borrelia, Bartonella, and Babesia. And that kind of goes over some of the things I was just talking about, okay? And then in terms of mycotoxins and how to figure out if you have that, look in this section called Detoxification and look at this article called Mold Toxin Illness and Lyme Disease, okay? And this one lays out why the urine test is better. I also review, Dr. Shoemaker is the doctor that came up with this whole concept of trying to make a mold toxicity diagnosis based on a genetic profile. I let you know in this other article over here why I think his approach is all wrong, okay? Especially in Lyme disease. So these are two helpful articles for you to take a look at as well too, all right? All right. Thanks for the question, Alex. Good luck to you. So I want to let you know the room that I'm sitting in has my intake air duct for my air conditioner. So, and it's hotter than you know what down here in Texas right now. So I apologize if you're hearing that intake air duct. I've tried to dampen it as much as I can, but you may be hearing a little bit of an air sound in the background there. So I apologize, but I can't control it. It's too hot outside right now. So anyhow. Hello, Tim. Let's see here. Hi, Dr. Ross. How are you? I'm doing well, thank you. I was wondering if Lyme or any of the co-infections can cause new moles to appear on the body. I had about 7 new ones appear over the span of 2 weeks. I haven't been in the sun. Thank you so much. So, Tim, I haven't seen that a Lyme, Bartonella, or Babesia cause you to get more moles, all right? However, the family of antibiotics that many of us use to treat Lyme and even Bartonella, and can sometimes be part of Babesia treatment, are the tetracyclines. So doxycycline, minocycline, tetracycline. All right, those are the tetracyclines. All of those cause increased sun sensitivity and can lead to more darkening of the skin, including darkening of very light moles that may have been there now becoming more apparent. Now, these are not causing any harm to you, but you will see some skin darkening. Sometimes you will see more appearance of moles because they may just be light ones that are there that now get dark as you're actually on a tetracycline. I'm not aware of any other antibiotics leading to that, though, so, and nor herbal antibiotics leading to that. Okay? All right. Thanks for your question, Tim. Good luck to you. Hello, Denise. Let's see. Hi. My daughter has Bartonella with psychiatric issues and has mild autism and strong ADHD. Is there a correlation between autism and Bartonella? Are the kids with autism more prone to getting chronic Bartonella? What is the reason behind? And is there a relationship between being susceptible to mold, environmental toxicity, and having Bartonella Lyme, or having autism and ADHD? All right. So the thing about autism and autism spectrum disorder is a condition for which there may not be one cause in a person. There may be a number of things that lead to this problem developing. In terms of could tick-borne infections be part of the picture, the answer is yes. Lyme, Borrelia infection, the Lyme germ, can sometimes be part of it. In some people, sometimes Bartonella can be part of it. All right. And so we tend to think of Bartonella, especially when people have a lot of neuropsych conditions like autism, like ADHD. Those would be things, and psychiatric issues. We tend to think of Bartonella, but I want to let you know Lyme can sometimes be part of it as well too, although Bartonella has a greater tendency to do that. All right. In terms of, let's see, what is the reason? So it isn't that kids with autism are more prone to getting chronic Bartonella. It could be that chronic Bartonella is a contributing factor to their autism. I would flip that discussion around a different way, okay? In terms of causal effect, I would flip that around. What is the reason behind that? And is there a relationship between being susceptible to mold, environmental toxicity, and having Bartonella? No, there's not a relationship. As I was trying to say, when somebody has a chronic illness, sometimes it is not that there is one cause. It can be that there are multiple things that add up to create the whole problem. And that's what makes treating chronic mold toxicity, autism, chronic Lyme disease, chronic Bartonella difficult, especially in the standard medical community, because in standard medical doctors, like I was trained, we're all taught to think about identify one cause for the problem. I got to tell you, that doesn't work when you have chronic fatiguing illnesses and chronic illnesses like autism. You have to think more in terms of, I call it a total load phenomenon. These are total load phenomenon illnesses. And basically, if you put enough medical problems into a rain barrel, eventually that rain barrel overflows, and that overflowing rain barrel is illness, okay? And so in the case of autism, maybe there's some Bartonella contributing. Maybe there is some mold toxicity contributing. Maybe there is some chronic yeast overgrowth contributing. Maybe there are some food allergies contributing, okay? There's all these things that can contributing. It doesn't mean you necessarily need to fix every one of them, but if you remove and lower the effects of enough of them, eventually your rain barrel stops overflowing and you have less of a total load effect on the body, resulting in illness, okay? So that's how I tend to look at these illnesses, all right? All right. Thanks for the question, Denise. Hello, Isa. Let's see. Hi, Dr. Ross. My friend Chris has been experiencing some odd and progressive symptoms over the past 6 months or so. He has had muscle loss, extreme muscle contraction, and loss of range of motion in his arms, hands, and legs. His muscles are functioning so poorly that he can't make a fist or straighten his hand, and he's starting to have difficulty walking because of extreme stiffness. His muscles feel very hard to touch. He also has hair thinning all over his head, loss of body hair on chest, arms, chronic constipation, white patches on the eyelids, scaly patches on the ankles that look like ichthyosis, bumpy lines discoloration on arms and legs, 6 months cold and heat intolerance, low appetite, occasional lightheadedness on standing. He has seen his GP is referring him to neuro for testing and done a lot of blood work to rule out various autoimmune diseases. His test results are showing iron. So it looks like there's two parts to this. I have to see if I can find your second. Here we go. Hold on a minute. His test results are showing iron deficiency and inflammation among other abnormal results, but nothing that makes sense to anyone so far. A normal thyroid stimulating hormone and low T4. He's also been referred to an internist clinic. Based on your website, it seems like this is consistent with some type of thyroid symptoms you have seen in your patients. Does it seem worth supporting the thyroid through supplements or taking desiccated thyroid for a trial period? We have an appointment with an alternative doc who will prescribe thyroid at the end of September. Should we see her more urgently? Thanks for your help. So Isa, what I would say is this is the muscle loss and the spasticity do not quite fit a low thyroid type of situation. That's not to say there couldn't be a component of low thyroid in his condition, but it doesn't fully fit. And I agree with the idea that a neurologist gets consulted here to figure out if there is a neurologic disorder. So if you've got problems with nerves functioning, so wherever muscles to work correctly need innervation, okay? And the nerves send a signal to the muscles to contract and relax, but they also release chemicals to the muscles that cause those muscles to have mass. All right, so if neurologically a muscle, or there's some problem with the neurologic interaction between the muscle and the muscle may lose its mass because it's not getting the chemical signals from the nerves to retain mass, okay? So do I think thyroid would fix all this? No. Do I think thyroid might help with a component of it? It's worth a trial. And your alternative naturopathic doctor, I think, would probably be able to help you with that. In terms of, I know you're Canadian, and I know that for various reasons, but in Canada, I know it's very difficult to get in with your specialist. The general internist in Canada function differently than they do here in the States. And so just everyone, I want you to know that. In Canada, the general internists function like specialists. They're the specialist that can handle a lot of complex problems and then will do further referrals. And they're easier to get into than getting to your super specialist, like your cardiologist and like your neurologist, okay? So I actually do agree with your GP having the internist also get involved here to see if they can figure something out. But clearly, this is more, I would say, than just a thyroid disorder, although thyroid could be a contributing factor here. All right? All right. Good luck to you, Isa, and good luck to Chris, too. Thanks for the question. Hello, John. Let's see. Can COVID, a cold, flu, or any other virus reactivate Lyme, Babesia, or Bartonella? Also, for us Lyme patients, do you recommend getting the COVID booster in case you get COVID, or just take Paxlovid instead? Let me try to kind of look at all that. So it is possible that when people have Lyme, Babesia, and Bartonella, that over time, getting treated, that either the infections get eradicated or they get put into remission where the immune system is basically controlling the germ load, keeping it low so that somebody doesn't have symptoms of those illnesses, okay? And it is possible that if the immune system gets distracted dealing with another major problem, that there could be enough immune suppression in its ability to fight and control Lyme, Bartonella, Babesia if a person has had those in remission, that they may start getting symptomatic again. In terms of the type of situation that could lead to that, yes, COVID could do that. I have seen that happen in a number of my patients, not many, but it is possible that having had COVID, can lead to some reactivation of Lyme, Bartonella, or Babesia that is in remission. Keep in mind, though, it does get tricky because there is long COVID that probably has a lot of similar outcomes and leading to illness similar to what Lyme, Bartonella, and Babesia can. So, for instance, one of the things that happens in long COVID is that people can get mitochondria dysfunction. Their energy factories in their cells don't work well. But we also know Lyme, Bartonella, and Babesia can do that. Okay. In addition, people with long COVID, many seem to be having symptoms of mast cell activation syndrome. And keep in mind that Lyme, Bartonella, Babesia can also trigger mast cell activation syndrome. My approach when I have had a patient that has had Lyme, Bartonella, Babesia, and generally was doing fairly well, and then they got COVID and got clobbered, and they're about 2 months out, and they just don't seem to be recovering well enough. That's when I usually start saying somebody has long COVID. I usually, with my COVID patients, have given most of them about 2 months to get back to a good state. And generally, most people do over a 2-month period of time. But after 2 months, you've got to start wondering whether their symptoms are long COVID or whether there has been some reactivation of Lyme. My approach has been in those situations is to, number one, start people on treatments for mast cell activation. I like to get them on quercetin, which is an herb that stabilizes your mast cells so they don't make and release as many histamines, for instance, okay? I like to try to get, I sometimes, if somebody's having a lot of allergy symptoms or hives with that, will also put people on an antihistamine called Zyrtec. I might do that as well, okay? And the other thing I like to do is to get people started on something called low-dose naltrexone. The reason I like doing that is, so naltrexone, many of you know, is a narcotic blocker, okay? And our body has a natural narcotic system called endorphins. If you temporarily block your endorphin receptors, that leads to those receptors becoming more susceptible to endorphins that are there. And your brain doesn't like it. And the brain causes more endorphins to be reduced. So when the naltrexone wears off from its blocking your endorphin receptors, these endorphin receptors get flooded with extra endorphins and they're very sensitive to them. Endorphins regulate your immune system, okay? The other thing that naltrexone does is your mast cells, your allergy cells, have a receptor called a toll receptor on them. And the toll receptors get bound by the naltrexone. And when they're bound, these mast cells are less reactive. They release less histamines, okay? So I use low-dose naltrexone in long COVID to help manage the possibility of mast cell activation. And in addition, I use it for its immune regulation potential to help get any autoimmune triggered illness caused by COVID under control, okay? So those are two reasons I'll do that. Keep in mind, Lyme, Bartonella, Babesia can also trigger mast cells. And there is immune dysregulation in Lyme, Bartonella, Babesia. And so adding in low-dose naltrexone when I'm still trying to decide are those infections reactivated is also helpful in case they are as well too, all right? Now, we do not have accurate testing that tells us if Lyme, Bartonella, Babesia have gotten active. It's more of a clinical sense that I use. But before I go there, I usually want to try quercetin. I want to regulate cytokines with curcumin, 500 milligrams 3 times a day, the quercetin to regulate the mast cells is 250 milligrams to 500 milligrams 3 times a day. Zyrtec is 1 pill once or twice a day to block histamines. And then add in the low dose naltrexone starting at 1.5 milligrams, eventually working up to 4.5 milligrams a day. And I see how my patients respond over 2 months. After 2 months, so we're now 4 months out from when they got COVID, if they're not getting much better, then I might start adding in treatments for whatever co-infection symptoms seem like they could be part of the syndrome, okay? So it's tough because we just don't have a decent test that tells us whether these germs are reactivated or not. Now, have I ever seen cold or flu reactivate Lyme, Babesia, and Bartonella? No, I have not, to be honest with you. Okay. All right. But long COVID potentially can. Okay. And then in terms of the COVID booster, that's a tough one. The reason it's tough, I know that the authorities are recommending the COVID vaccine, the booster right now. And as you know, during the pandemic, I was a supporter of getting the COVID vaccine. Now, all you anti-vaxxers, I don't want to hear it from you, okay? That was the position I took back then. I think there is sound science that says people did better when they had the COVID vaccine. I do not, any of the science that says people get harmed from the vaccine. Yes, there are a small percentage that do, but far more people got benefit from the vaccine than got harm from it. And if you don't like that, you don't like my view on COVID vaccines, then you don't have to participate in my webinars, okay? But I was a supporter then, all right? Now, I'm not as big of a supporter. And the reason I'm not as big of a supporter is I do think that having had previous vaccines and having had exposure to COVID in our environment that many of us have had, is our immune systems now are more revved up and ready to handle COVID if we get it. And I do believe we should be prudent with our uses of all vaccines. I do agree there is some concern that if you use vaccines and there's not a lot of great risk of harm from an illness, there is some chances maybe we get side effect reactions from the vaccine. And so I try to look at what is the greatest chance of risk and benefit. At this point, even for people living with Lyme, most of us, if we had the vaccines and if we had exposures to people from COVID in our environment, most of us have some immune abilities in us now to handle COVID if we were to get it again. Now, it may not mean our immune system is finally tweaked to the latest strains that are out there, but we still have the capacity to deal with it. So generally, I am kind of not recommending the COVID boosters at this point. Okay. All right. Now, what's interesting, when I post this on YouTube tomorrow, I'm going to get a censor warning now because I just did not give the party line on COVID. In other words, I did not say that everyone should get the booster. And YouTube edits these things and they see it. So you'll see when you look at it, there'll be that COVID disinformation label on my video tomorrow now. And as many of you know, I'm not trying to be a peddler of false information. I'm just giving you my sense of things at this point. Okay. All right. So anyhow, I hope that gives you some useful information there. In terms of the Paxlovid, I think it's a fair thing to say if you've got some immunity, because we all probably do it to some degree now, either from having had it, getting vaccinated, or being exposed from our environment. I think it's a fair thing to say that, you could treat it with Paxlovid if you were to get it, if you choose to forego getting the boosters. Okay. All right. Thanks for that question, John. And good luck to you. Hello, Carter. Let's see here. Oh, I want to do a screen share of some of the things I just identified on that last visit or that last question. All right. So one of the things that I did talk about was mast cell activation. And so let's go there. All right. So in my Lyme information site, again, in my online Lyme guide, you can find information about mast cell activation in the immune system section here. And this is the article I've written called Mast Cell Activation Syndrome in Lyme. Okay. The points I make about Lyme triggering mast cell activation, I point out in here that chronic infections of any kind can activate your mast cells. And I talked to you about the steps to regulate your mast cells here. There's more information than I just gave in my answer there. Okay. All right. And I talk about quercetin in here. I talk about Zyrtec in here, for instance. Okay. All right. And then in terms of naltrexone, low-dose naltrexone. Huh? Well, how do you like that? I forgot to put it in here. Oh, there it is. So here's my article on low-dose naltrexone and the various reasons you might want to use it, including regulating your immune system and including making your mast cells less reactive, okay? And so take a look at my article there where I talk about how do you start it and how do you dose it as well too. All right. Hello, Carter. Let's see. Many infections are iron hogs, with Bartonella being one of them. The proposed benefit of the gallium nitrate is that it mimics iron closely enough that Bartonella does not have the ability to metabolize it, so it ties up all the receptors and starves while trying to accumulate it. Funny how a lot of these old cancer drugs have secondary mechanisms of action being antimicrobial. So Carter, thank you for letting me know about that. I know that this gallium nitrate is quite the buzz on the in the different support groups at this point. What I would let you know is it's an interesting theory. I'm interested to see will it withstand the test of time. As many of you know, in the world of Lyme disease, we have the IT treatments of the season that get everyone's attention, okay? It used to be that doing doTERRA essential oils was the thing that was going to solve everybody's problems, and everybody rushed and tried it. There was a season where we all went through something called LDI, or low-dose immunotherapy, and everyone thought that was going to be the thing that was going to solve it. And the latest buzz right now is the gallium nitrate, and we'll see. There's no science about it. There's no petri dish studies. There's no human studies that said it will do something. I appreciate the rationale behind it, but we'll see. All right. So thank you for that. Oh, the other big thing that everyone was rushing to try 2 years ago was disulfiram. And yeah, maybe about 20, 30% of people actually got great help out of that. The majority of people did not. And so most of us are probably not offering it as a frontline treatment anymore either. All right. So we have to be careful at these new things that we all think are going to solve our problem, because the majority of them probably don't, unfortunately. I'm sorry to be a bearer of bad news, but the majority of these things don't withstand the test of time. Okay. All right. Thanks for bringing it to our attention, though. Hello, Gail. Hi, Dr. Ross. Thank you for all the information you have given me over the years on your website and webinars. You're welcome. Let's see, can BBC 157 be taken with food and or other supplements? Also, I'm on so many herbs and supplements, and I have high mycotoxins, but I can never find a time twice per day to take mycopol, etc., away from food and other supplements. Any tips for how to get it all as directed in over the course of the day? You may not be able to help with this second question as you don't know what I'm on, but I know the binders have to be taken 1 hour before or 2 hours after food supplements. I find this so impossible. All right. So in terms of the BPC 157, so everyone, that's a peptide that is made in the stomach lining that has a number of benefits. So it can help repair tissues like joint injury, nerve injury, for instance. It also can help regulate the immune system so it's not as inflammatory. And so it's very useful in treating Lyme and even sometimes bull toxicity. It can be something useful. It can be taken with or without other foods and with or without it can be taken with or without other supplements, and it can be taken with or without food. Okay. All right. Now, in terms of your binders, using a mycopol or a GI detox to bind up mold toxins in your intestines, here's the timing that I usually suggest on it. Okay. It's a little bit different than what you just said. So you want to make sure that you basically stop all other medicines or supplements beginning 1/2 hour before you take your binder. And then you can resume those medicines and supplements 2 hours after you take your binder. It is actually okay to take food with your binder, but the ideal time to take food would be about a 1/2 hour after you take your binder. Although any time in that 2.5 hour window that I said is okay to have food. The reason a 1/2 hour after you take your binder is ideal is that your liver, when it tries to clean out mold toxins, doesn't clean them out well, but it moves them into the gallbladder. Your gallbladder squeezes out its contents into the small intestines as you eat, okay? And so if you take your binder a 1/2 hour before you eat, your binder will have worked its way down into the part of the small intestines where the gallbladder squeezes its stuff out. So it'll be there in a better position to catch stuff that was stored away in your gallbladder. All right. All right. So just be aware of that. Okay. Although you still get benefit even if you don't take it, if you don't eat right after, a 1/2 hour after you have it. Okay. Now, my patients that have these really complicated schedules that make it hard to find time twice a day with that 2.5 hour block of time I was just telling you about, usually what I will have them do is to try to take their binders only one time a day. So if you were trying to do mycopole, 1 pill in the morning and 1 pill at night, you could try to see what benefit you get by just taking 2 pills 1 time a day, for instance. Okay. So that's something to think about as well, too. All right. All right. Good luck to you, Gail. Thank you for that question. Hello, Albert. Let's see here. Hi, Dr. Ross. You answered this question the day the audio wasn't working. What day was the audio not working? Boy, we did have a hard time with that, didn't I? Anyhow, yes, there were a number. There was a webinar maybe a month ago that my microphone wasn't connecting. I had total dysfunction. So I literally talked to the camera for an hour and a half, and none of you could hear me. So it wasn't good. But anyhow, it looks like it's working tonight. No one is making comments to me about that. So anyhow, hi, Dr. Ross. You answered this question the day the audio wasn't working, so I'm resubmitting it. My son is a college student who has trouble with the logistics of taking his cryptolepis, skull cap, and biocide tinctures as often as recommended. He also takes a cinnamon clove oregano, knotweed, cat's claw, houttenia, and sidacuta in pill form, which he is able to use as directed since he can carry pre-made pill packs with him when away from home. I think you recommended 1/2 teaspoon cryptolepis tincture 3 times a day. If he is only doing it once or twice, might it still be effective? And should he increase the amount he takes if frequency is decreased? 2, any suggested dosing on skullcap tincture? 3, how long might it take to determine if this regimen is working? 4, when would you upgrade to prescription antibiotics, and what would be your first choice prescription combination for Lyme and Bartonella that was reactivated by COVID? All right, so let me try to work through these in order. Number 1, so one thing I will let you know, it is notoriously difficult for teens and young adults, so in your low 20s, to be able to take things. It's just hard. It's hard to organize your life to take things multiple times a day. So what I try to do in my developing regimens for teens and young adults is to try to consolidate everything into 2 times a day. And that 2 times a day, well, with the exception of your probiotic, that's the only problem area. But in terms of all your medicines and supplements except your probiotic, you could literally take them all together in the morning before he leaves the dorm. And then when he comes back at night after dinner, after studying, whatever he's doing, he could take his second round at that time. Okay. All right. Is that ideal? No. Is it the most ideal for a teenager or young adult? Yes, because you're getting the stuff in basically. Okay. In terms of the cryptolepis, which I usually do recommend it 3 times a day, when you change your dose to doing it twice a day, you basically take the amount that you were doing 3 times a day, whatever that total amount is, divide it by 2 and do half in the morning and half at nighttime. Okay, so that's your way to do that. The probiotic is the wild thing because he's not going to be able to take probiotic with his herbal antibiotics. He shouldn't in the morning or at night, but that's a pill. So he might be able to take that with him during the daytime. Okay. All right. Number 2, any suggested dosing on skull cap? Generally I would work, for an adult sized person, I would work up to 30 drops twice a day. That's how I do it. Okay. And then, 3, how long in terms of things working. So let me just give you a timeline of infections. Okay. So the Lyme germ versus Bartonella versus Babesia. I'm just going to focus on those 3 infections. All right. So if a treatment is working, and that could either be prescription antibiotics or herbal antibiotics for both Babesia and for Bartonella, usually by 2 months into full amounts of your regimen. So that may take up to 3 months for the 2 started because some of these things you ramp up. Okay. But after being on full dose for 2 months, you should start seeing some improvements in the Babesia symptoms or in the Bartonella symptoms. Okay. Now I said improvements. I didn't say they're gone. Okay. But typically on average, a Babesia treatment is going to take about 5 months to be done. And a Bartonella treatment is going to take about 6 months to be done successfully in about 80–85% of people. There are a group of people with Bartonella and a group of people with Babesia that get it chronically, and it's going to take longer than the time frame I was just telling you. Okay. But if you're on something and it's helping, you should start seeing a reduction in Babesia symptoms or in Bartonella symptoms by 2 months at the full doses. Okay. All right. So what symptoms do I follow for Babesia? Well, I look and see at the beginning, did they have air hunger? Did they have racing and skipping of the heart? Did they get lightheaded easily on standing? Did they have a lot of frontal headaches? Did they have a lot of nighttime sweating? Those are the kind of symptoms I'm going to follow for Babesia. And also some people with Babesia have frequent deja vu experiences, okay? So if they're a person that has a lot of deja vu and you follow that and it starts getting better, that means your Babesia treatment's working, all right? For Bartonella, the kind of symptoms that I follow are pain on the soles of the feet, severe cognition often is part of Bartonella, though it can be part of Lyme, but severe cognitive problems, psychiatric problems like ongoing anxiety, depression, neurologic conditions like tremors and shakes or seizures. You want to just see what those were at the beginning. And then usually by, again, 2 months at full dosage, you want to start seeing some lessening of those symptoms. Okay. All right. Now, if things aren't getting better in that time frame, then you want to make a change. Now, that doesn't necessarily mean you need to go to prescription antibiotics. It may mean you try a different herbal regimen than what you've used, but make a change. And also, likewise, if you're on prescription antibiotics, antimicrobials, and you're 2 months in using them at full doses and you're not getting benefit on Babesia and you're not getting benefit on Bartonella, then you need to change to a different prescription regimen or a different herbal regimen. You can even go herbal if you want to. All right. Okay. Now, Lyme, Borrelia is a different animal. And so a colleague of mine a number of years ago did a study in his office and he presented at one of the ILAS meetings, maybe 15 years ago or longer now. And he did a study trying to see how quickly would people turn around if they had Borrelia by itself, not with Babesia, not with Bartonella. And he put everyone on the antibiotic clarithromycin and the antibiotic flagyl, also known as metronidazole. And then he just waited to see what happened. And what he found is that by 3 months, 30% of people started having improvement. By 6 months, 60% of people started having improvement. And by 9 months, 90% of people started having improvement. So in terms of Lyme germ, sometimes you may not see any improvements even by 6 months in. And so if there is Lyme and you're not seeing things, any improvements in what I would call the non-Bartonella, non-Babesia symptoms, sometimes you just got to stay on the same treatment and give it more time. Okay. All right. All right. Then let's see here. When would you upgrade a prescription antibiotics? All right. So, I would at least, if it's the Lyme germ, I might wait 6 to 9 months. If it's a Bartonella Babesia, you can still look at different alternative regimens for the herbals. But, again, if you go 2 rounds of herbals and you give each of them 2 months or more and they're not having benefit, then I think it's time to go to the prescriptions, okay? Right. Now, for Lyme and Bartonella, these days, a good treatment that I like using is to use a combination of, well, you could look at, so I like using fluconazole. I think many of you know that. That's a diflucan, which is often used for yeast overgrowth. But in addition, it probably has anti-cyst effects against the cyst form of the Lyme germ. And on Bartonella, laboratory experiments show that it treats growing and hibernating forms of Bartonella, okay? So if you use diflucan, so let me talk terms here real quick. So the Lyme germ has different appearances and it has different growth states. The appearances are, there's a spirochete. That's the thing that looks like a corkscrew. Many of you have probably seen pictures of that on the internet. There's another appearance of the germ, which we call the L form. It's a kind that moves inside of your cells, lives inside of cells. It doesn't have any covering. We call that the L form. And finally, the third form, the third appearance, is a microscopic cyst form of the germ, okay? Not a big skin cyst, but a microscopic cyst form, all right? And these spirochetes and L form and cyst all can morph and go back and forth. So when you design a treatment, you need to make sure you're on things that treat all 3 forms at the same time, okay? All right. In addition, these forms can be growing or they can be hibernators, or we call those persisters. And so we want to be on something that deals with the persisters as well, okay? Bartonella has only one appearance, but it has growing and hibernating persister forms, okay? Diflucan is good for persister Bartonella, all right? And you want to combine it with one other intracellular agent, and for that, you can use as azithromycin, or you can use a clarithromycin, or you could use a doxycycline, or you could use a minocycline. Any of those can combine with your diflucan. So on the Lyme side of things, then, the diflucan would be your anti-cyst agent, and the doxy or clarithromycin or azithromycin would be treating spirochete and intracellular, okay? There's one other thing you should add, or that I would recommend that people add in this situation, and that is I'd like them to be on liposomal cinnamon clove oregano capsules. That's 1 pill twice a day, and the reason I do that is also anti-persister Lyme and anti-persister Bartonella. And with this, if you just use fluconazole with that second antibiotic, you don't have any persister effect, anti-persisters benefit for the Lyme germ, okay? All right. One other reason to use the cinnamon clove oregano, 1 capsule twice a day, is in addition to going after the hibernator Lyme and the hibernator Bartonella, is it can help break up biofilm slime layers that cover the germs as well too. All right. All right. So that's something for you to think about. All right. All right. So everyone, I know that's a long-winded discussion there, but I hope that gave you some useful information as well too. All right. So if you're looking for more information about persisters, take a look at and how to treat persisters. Take a look at my Lyme guide and take a look in the infection treatment plan section here. And there is this article called How to Treat Persister Lyme and Bartonella, where I review various herbal as well as prescription options for you to do too. Okay? All right. Let me see one other thing. I'm going to look and see if there may be another article. Oh, here. So there's this section called Recovery Time and Odds. And so take a look at this article. When will I start to feel better? Okay, that's the timelines that I was just covering about when do you start seeing improvement for Babesia, Bartonella, and Lyme. Okay, so take a look there. That will give you some information as well too. Similarly, you can find that information in this article, Getting Healthy, Will I, When, How Do I? Okay. All right. All right. Thanks for that question. Good luck. Hello, Timothy. Let's see. How big of a component is the celiac or low output pancreas, such as high anti-gliadin antibodies and low elastase and high steatocrit? Do you recommend supplementation or any action? Okay. So your pancreas, everyone, is the organ that is responsible for making insulin. Okay. It helps regulate your sugar, but it also makes your digestive enzymes. And one of the things that can happen if you get an imbalance in healthy bacteria in your gut, the gut lining will not send signals to the pancreas to make adequate levels of pancreatic enzymes. And one way of seeing if that is happening is to look at this elastase level, right? So low elastase means some degree of pancreatic dysfunction. The way that I like to approach a pancreatic dysfunction is, number one, try to support the healthy microbiome by being on probiotics. And the probiotic I prefer these days to help rebuild the microbiome, even if you're on antibiotics, at least support the microbiome, is a product by Research Nutritionals called Multibiome. And I would do a couple pills in this situation, one time a day. Multibiome is a product that has two different classes of probiotics in it. One of the classes is probiotics that normally would live in our intestines. And the other class is bacteria probiotics that come from the soil. Those soil-based probiotics tend to survive the stomach acid better, and they do a good job of supporting your existing bacteria in your gut to behave better, to function better, okay? And so that's a Research Nutritionals product called Multibiome, 2 pills, one time a day. The other thing that I often will do in situations like this is to work with digestive enzymes. I like working with an integrative therapeutics product called Similase, and I'll have people take a couple pills before meals 3 times a day. And if they're noticing that their looser stools are getting better, great. If not, I might even go up to 3 pills before meals 3 times a day on that. Okay. And then the anti-gliadin antibodies could suggest that a person has celiac disease. And in celiac disease, basically there is an immune reaction against gluten found in your food. And gluten, and that can lead to a lot of inflammation. It can lead to gut dysfunction as well too. So the only way to truly know if you have celiac disease is actually to get a biopsy of your small intestine after you've been taking gluten for a while, so they can see, do you have the inflammatory changes on biopsy? But another way you could look at it is with these anti-gluten antibodies is basically go gluten-free and see, does that have benefit too? All right. Now, there are some other grains that have similar proteins in them that look like gluten. They're not gluten. And so sometimes people with celiac has to, not in addition to removing gluten and wheat, they have to remove rye, oats, barley, and sometimes corn. Okay. So it gets to be kind of difficult, but I would probably just start by doing the pure gluten, which would be wheat first, give it a couple month trial and see if that makes a difference. Okay. Right. That's how I would approach it in my office, at least. Obviously, these are things you should talk to your own doctor about to see what they think is right for you. Okay. All right. Thanks for that question, Timothy. Good luck. Hello, Lynn. Let's see. Hi, Dr. Ross. Can Lyme or Bartonella cause uterine or abdominal cramping? My main symptoms are headache, fatigue, nausea, abdominal cramping, and limbs that go numb easily. Legs go numb sitting on the toilet. Arms go numb if I rest my head. Have had Lyme, Bartonella, Babesia implanted in the past, and I had headache and limb numbness thing when I had those infections as a group before. All right, so let me read your first question here. Can Lyme or Bartonella cause uterine or abdominal cramping? You know, so Bartonella and Lyme can sometimes cause GI dysfunction. And obviously the GI tract goes by the uterus. So sometimes you can get cramping that's intestinal cramping that feels like uterine pain. Lyme can also lead to a condition called endometriosis. Sometimes it can be the cause of endometriosis, where you get growth of tissues that should be found only on the inside of the uterus. Those tissues start growing on the outside of the uterus, sometimes on the abdominal organs as well too. And that can lead to uterine pain as well too. All right. So those might be the relatednesses of pain in that area. Could be some cramping of the intestines triggered by neurologic dysfunction of the intestines due to Lyme and Bartonella. And then again, in addition, the uterus itself sometimes can develop endometriosis triggered by Lyme. Okay. To figure those things out, especially the endometriosis, would be to visit with a gynecologist and get a good gynecologic exam. All right. You may even need ultrasound on that as well too. 2, would this cluster of symptoms lead you to suspect one or more of these infections has returned? And if so, what would you suspect? 3, does the numbness thing seem like a circulation issue, which might benefit from lumbar kinase? And 4, finally, COVID ran through our family in April. How would you differentiate long COVID from tick-borne infection reactivation with this symptom set in history? So again, on the long COVID, in situations like this, I usually will try to approach the long COVID by dealing with some of the ramifications of that, which is mast cell activation and immune dysregulation. And I mentioned this earlier tonight, I like doing a trial of quercetin. I like people being on Zyrtec. I like trying low-dose naltrexone. Okay. I like doing things to lower cytokines with curcumin as a product called Thorn Mariva 500 milligrams twice a day. I would give all of that about a 2-month trial to see if it makes any difference. And if not, then it may be time to start thinking about there could be reactivation of tick-borne infections. All right. And then number 2, you said, would this cluster of symptoms lead you to suspect one or more of these infections has returned? Let me see here. Headache, fatigue, nausea. So I will say, if you've had COVID leads to a lot of abdominal microbiome disruption, leading to this kind of GI stuff going on with you too. I can't tell you based on those symptoms whether this is Lyme, Bartonella, Babesia. My focus would be probably on supporting your gut microbiome with good probiotics, going after some of the mast cell activation, like I said, doing some of the cytokine control with the low-dose naltrexone, quercetin, curcumin kind of combinations, and Zyrtec possibly too, and see where things go. All right, that's tend to be what I do in situations like this. Let's see, the numbness could be from not necessarily from circulation, but rather you've got inflamed nerves that are more being easily agitated when you sit on them and put your limbs in situations where the nerve gets pressed more easily because it's now inflamed and swollen, basically. Okay. So I would, again, as I said earlier, I would probably approach this by trying to regulate some of the stuff that happens with long COVID first, give it a 2-month trial. And if that doesn't work, then it's time. The way my approach has been is then it's time to start thinking, could you have reactivation of Lyme and co-infections? Okay. Anyhow, that's what I got for you. So good luck to you, Lynn. Hello, Maria. Hello, Dr. Ross. A question regarding Biocidin. I've started treating Candida and I'm taking Biocidin in capsules. I'm still one time a day and can't increase. When I take them, I get severe dizziness. I'm very wobbly on my feet. Could you please say a few words about what should I do and why it happens? Thank you. So one thing we have to be concerned about whenever we take antimicrobials, antibiotics, herbal, or prescription is that sometimes when you feel bad, it can be a side effect. And sometimes when you feel bad, it can be due to a Herxheimer reaction, okay? So let's talk about a Herxheimer reaction first. So when you have chronic yeast overgrowth, or you have chronic Lyme infection, or you have chronic Bartonella, chronic Babesia, or you have chronic mold toxicity, one of the reasons you feel like crap is that your immune system, in trying to deal with these infections, manufactures a bunch of chemicals called cytokines, okay? Now, cytokines are good and bad. On the good side, white blood cells make these cytokines, and those increased cytokines cause more white blood cells to be made. They help white blood cells work better, and they bring the white blood cells to where the infection or the toxin is, all right? That's all good. But in chronic yeast, chronic mold toxicity, chronic Lyme, chronic Bartonella, chronic Babesia, the immune system doesn't do a good job, but it tries harder and harder, and it starts producing excessive amounts of cytokines. And excessive amounts of cytokines give you what we call Lyme symptoms or mold toxicity symptoms, okay? So excessive cytokines make it so you can't think, give you fatigue, make you hurt all over, make it so you can't sleep, disrupt how your hormonal systems work, okay? You kind of get the picture here, all right? So all of these conditions lead to cytokine excess syndromes, all right? Now, what a Herxheimer reaction is when you first start killing germs, sometimes the immune system will see those dead bug parts and react by making more cytokines. And so a Herxheimer should be worsening of your existing symptoms. A Herxheimer should not be new symptoms that start, okay? So if as part of your condition, you've already had, before you started Biocidin, you had a lot of dizziness and wobbliness in your feet, maybe this is a Herxheimer reaction. But if part of your illness never had wobbliness on its feet and usually did not have dizziness, then this is likely a side effect, and you probably ought to stop taking this medicine because you can't manage a side effect like that, okay? All right. I think from what you're describing, and again, I don't get to ask you what all of your other symptoms have been before starting this, so I don't know. I don't get to ask you everything, okay? But I would suspect this sounds more like a side effect to me. And so if you're looking for other options to treat yeast that are herbal, you might want to take a look at a product called Capri Plus. That's CAPRI PLUS by a company called Karuna. I would start that at, I usually have people take 2 pills twice a day. So what's in that is garlic, caprylic acid, and some oregano oil, okay? The other option I will look at is a product by Integrative Therapeutics, which is called Phytostan, and that has in it some powder caprylic acid, rosemary and thyme oil, and something called indolacinic acid. That also is 2 pills twice a day. I suspect you're having some reaction to something in that product that is not a Herxheimer reaction. Okay. All right. But you should talk to your physician to see what they have to say as well, too. Okay. All right. Good luck to you, Maria. All right. So let me just, I want to show everybody an article here real quick. All right. So we're back here at my Lyme disease information site. So in terms of cytokines, take a look at this section called Herxheimer and cytokines, okay? And so you could read this one where I talk about cytokines and what the symptoms are and how you manage it. And in this article, it's kind of similar. It's Herxheimer reaction. It helps talk about what does a Herxheimer look like and makes the argument that it's a cytokine surge. And so it should give you a manifestation, more worsening of your existing symptoms, not new ones, okay? All right, let's see here. Hello, LS. About a week ago, the tips of several fingers and bottom of toes started turning purplish, reddish, and really sensitive to touch. Eventually, the skin got papery and grayish on the bottom of my toes, and I peeled some of it off. Fingers very itchy too now. Have you seen this sort of thing before? Had a tick bite some years ago and been on herbals of knotweed, ashwagandha, cascala, turmeric, etc. over the years, but stopped at the end of last year because I gave up. Nothing was helping with the fatigue. I wonder if it's a neurologic symptom I'm now getting with my fingers and toes and tingling sensation on the head. What have you seen help with these sort of things? When I had my EM rash several years ago, I was treated with only 10 days of Doxy. Do you think Doxy will help if I find a doctor willing to prescribe Doxy for me for a couple months? Thank you. All right. So what I wonder, and this is something you should talk to your doctor about because they need to examine you to help look at this as well too. There is a phenomenon that can be part of autoimmune illness, but also can be triggered by chronic infection as well too. And it's something called Raynaud's phenomenon. In Raynaud's, you get periodic spasm of your blood vessels in your digits, your toes and your feet, sometimes even your nose, that literally limits blood flow. And that can be painful. It can lead to discoloration changes. It can even lead to numbness, okay? What triggers this to happen, so having had infection sets you up for it, but ultimately when people find triggers, it is temperature variation. So it can either be sudden, they moved into cold or they went into hot. It can set this off, okay? All right. Now, your doctor should examine you, make sure they think that's what's going on or not. If it is what's going on, yes, it is possible chronic infection can be part of this, all right? There are, regardless of whether you want to treat chronic infection or not, there are some things you can do to manage the Raynaud's. One of the best things is to use a prescription medicine that is called a calcium channel blocker. It's a type of blood pressure medicine, which can sometimes do a good job with this. Another thing that can sometimes help is nitroglycerin creams that you put on your fingers as well too, okay? But I would really, that's a tough diagnosis for me to make just hearing you, okay? So that's something you should talk over with your healthcare provider. I don't think 10 days of doxycycline would be enough to set the ship back correctly here for you, unfortunately. All right? All right. Good luck to you. Hello, Doug. Let's see. Hi, Dr. Ross. When you retested people for mold toxins with real-time test, did you have them stop the binder for a period of time before the test to avoid it becoming a provocation test? That way it would be the same as when they first took the test, so that the true comparison can be between the new test and the original test. If so, for how long? Also, I'm currently on minocycline and tinidazole for Lyme, and we'll add rifampin later for Bart. Does tinidazole get persisters? I've read that it does. Not sure about Bart persisters, though. Finally, are you aware of a good oregano oil product that does not have alpha-lipoic acid in it? The Dr. Inspire product has ALA in it, and I'm intolerant to it. I'd use it to control yeast and treat Lyme and Bartonella persisters. Thank you very much. All right. So in terms of, hold on, I have to look back through this again. All right. So in terms of retesting for mold toxicity, what I have tended to do is I tend to have people stop their binders the day before they, I don't want them to be taking a binder and testing at the same time. So I like them the day that they're going to do their urine test, not to do their binders. They can even begin doing it the day before, on the evening the day before, okay? That tends to be how I do it, okay? In terms of, so minocycline and tinidazole is going to be primarily a treatment for Lyme. The minocycline is going to treat intracellular and L-form growing Lyme. The tinidazole may treat intracellular as well as cyst form Lyme. The tinidazole can break apart biofilm. Tinidazole has not been shown to have any, there's no laboratory experiments I'm aware of that show it is anti-persister. However, maybe it is. And the reason it may be anti-persister is, well, actually, no, I'm sorry. There's no evidence on the Lyme side that it's anti-persister. No one's even done Petri dish experiments to say whether the azoles, that family that tinidazole is in, do anything for persisters, okay? Again, persisters being hibernating forms of the germ, okay? In terms of rifampin, so adding rifampin in along with minocycline turns this into a good Bartonella treatment. However, it again doesn't do anything for persister Bartonella either, all right? And so, yeah, usually in situations like this, I like people to take something else that's going to deal with the persister Lyme and the persister Bartonella. Your options are to take cinnamon, clove, oregano, and I understand you have some concerns here on that, or you could do herbal cryptolepis, which is something historically we've used to treat Babesia, but Petri dish experiments published out of Johns Hopkins a little over a year ago now show that it's quite an active agent in the lab against growing and persister Lyme and growing and persister Bartonella. If I'm using it for those purposes, I'm usually going to dose an adult at a half teaspoon 3 times a day. The other option, instead of crypto and instead of your cinnamon, clove, oregano, could be to use a Japanese knotweed, which again, based on laboratory evidence from Hopkins over a year ago now, looks like it has good activity against both growing and persister Lyme and growing and persister Bartonella. And generally, I try to have people take 30 drops of that twice a day, okay? Now, I want to do a quick screen share here and look at ingredients in the products I recommend for cinnamon, clove, oregano, and for oregano. So let's go look at product labels together here, okay? All right. So let me do a quick screen share here. Okay, so this is my supplement store. Many of you are aware of it. Anyone can order products from me The advantages of doing so is that I've hand-selected products that really do have the real ingredients in them. And because I choose manufacturers that do a good job of sourcing their ingredients. The other advantages in ordering from me is I pay for your shipping if your order is over $50, and I pay your taxes. You don't have to. So there's some advantages of getting products here. All right. In terms of looking at the products I carry for cinnamon clove oregano and oregano, let's see, we'll take a look here. Look at the doctor-inspired nutrition formulations. I think that's what you were saying. In terms of the cinnamon clove and oregano, ingredients, here we go. I'm just looking to see what they add here. Yeah, you're right. I do see the alpha lipoic acid there. Let me go back to their oregano product. It probably is the same thing. Yeah, so, I don't have an alternative for you there in terms of taking the oils. But again, as I was suggesting earlier, you could look at alternative herbal products that you take. Hold on, let me get back here where I can see you guys. So you could look at alternative herbal antibiotics that you're going to use on the persister side. And keep in mind the knotweed and the crypto also treat growing forms of Lyme and Bartonella as well too. Okay? All right. Good luck to you. Thanks for the question. Hello, Mosby. Let's see. Seems like when people get really bad herxes and go to the hospital, they just get IV fluids. But I never know how much to take because they say too much potassium is dangerous, too much salt raises blood pressure, and too much magnesium can lower the blood calcium. Is there a good rule of thumb target for the electrolytes? So if you get electrolytes in the hospital, they want to give you a fluid that has similar potassium and sodium levels to what your blood already has in it, okay? So that could be something like a D5, 1/2 normal saline with 20 milliequivalents per liter of potassium, for instance, would be a formulation that might work well for something like that, okay? All right. Good luck to you, Mosby. Hello, Cesar. Let's see. Hi, Dr. Ross. My daughter is treating for psychiatric Bartonella, 4 months on doxyfluconazole, cinnamon clove oregano, and supplements to support the immune system, decrease inflammation, and preserve the gut. Almost 2 months with most symptoms cleared. I'm really afraid of stopping the treatment and it relapses. 1, what is your protocol after stopping the antibiotics? Do you usually keep the supplements probiotics, and for how long? 2, do you recommend some kind of testing to keep track of the infection inflammation? 3, is it a good idea to keep treating with herbs like Cidacuta hutania for someone after stopping the antibiotics? 4, her main symptoms today are still lack of focus, some minor anxiety, worse cognition. What are the peptides recommended for these symptoms? Okay, so what my rule of thumb to do, regardless of what you're using to kill the Bartonella, is to use the herbal or prescription antibiotics until somebody is 100% well for at least 2 months, or at a good plateau, and no matter what you do, you can't get them to move forward for 4 months, okay? And in those situations, I usually stop the antimicrobials all at once. I don't taper, nor do I necessarily leave somebody on a regimen to police the environment, okay? I just don't. If they relapse, when I get them well again, in those situations, I will leave them on maybe half doses of Cidacuta hutania, for instance, to police the environment to keep the germs from coming back, all right? In terms of peptides that could be useful for thinking, and may help anxiety, maybe not. It's hard to say. we might look at a peptide called cerebrolysin, which is similar to a product called CerebroPep, made by Integrative Peptides. So cerebrolysin is a peptide made in the brain that can help repair brain trauma, brain injury. And that trauma can be from infections. It can be from getting smacked in your head. But these are things that can help repair brain injury. Okay, that's one thing I would look at. In an adult, I might work up to 1 pill twice a day on a CerebroPep. In a teenager or a younger person, I might look at 1 pill a day. The other peptide to consider using, because it repairs neurologic injury and also can help balance the immune system and repairs tissue injury in general, would be the peptide called BPC 157. And a standard adult dose would be 1 pill twice a day. I call a standard adult 150-pound person. If you've got a 75-pound kid, then you might just do 1 pill a day on that. Okay. All right. So those are some things that I would do in my practice. All right. All right. So everyone, oh, and good luck to you and your daughter. All right. So everyone, in terms of peptides, these are quite the rage right now. Although I will tell you lately, I think that everyone was rushing to try them, and I don't think as many people are finding as much benefits now. So I can tell you from my store that we're not moving as many anymore. We're not selling as many. But there are some people that really do get benefit, but I don't think it's the fix-all for most people, if you will. All right. So in terms of the article that I've read, let me just do a screen share on that. All right. So in terms of peptides, I'm going to make it easy. I'm just going to use my search bar here. So we're going to do peptides. Take a look at my article called Key Oral Peptide Strategies to Repair and Restore in Lyme and Mold Toxicity. Okay. All right. And in here, I describe each of the peptides that is available orally. And here's that cerebrolysin I was telling you about. And that is available as a product called CerebroPep by Integrative Peptides. All right. All right. Thank you for that question. Hello, Patsy. Hi, Dr. Ross. I'm submitting this on behalf of my friend who has a rash and is a little fatigued. The rash is not a typical bullseye. She attributes the fatigue to running around a lot. No ticks were found. She has not been in the woods, but is an avid gardener. Given that her only symptoms are a rash and fatigue, how long should she treat with doxy? Is a rash considered a symptom of Lyme? Patsy, this is not an easy answer here. I would need to know more. What part of the country are you in, so that I can determine what is the risk of getting Lyme from a tick exposure. And so, for instance, I would need to know more information there. And I would need to know more from actually directly questioning your friend. What symptoms do they have beyond fatigue? I know she's only saying fatigue to you, but I would need to query her directly to figure that out. So unfortunately, I'm not going to be able to answer this question here, but thank you for asking it. Good luck to your friend. Hello, Mary. Hi, Dr. Ross. What are your thoughts on ivermectin for Babesia? I took it a year ago and had a bad herx. I feel it must do something. You know, it's interesting. There's only, I think, one study that I have seen that says it might have benefit against Babesia. I will tell you, it's not really targeted specifically to the Babesia germ. I think there are better agents in my experience to use. So things like primaquine, things like tafenoquine, things like malarone, atovaquone, meperon. I think there are stronger agents that are going to give you a better chance of treating it. For information about what I do recommend, take a look at my article called Kills Babesia, a brief guide, where I talk about the main 2 ways to go after Babesia being what I call quinoline-based treatments. Those are ones that use tafenoquine or primaquine. And the other one would be atovaquone-based treatments. Those are ones that use Malarone or Mepron as the primary agent, okay? All right, that's where I find the most success, actually, okay? All right, good luck to you, Mary. All right, everyone, that's it for me tonight. I've enjoyed being with you here. Keep an eye out in your email tomorrow morning, where you'll get email notification from me that the recording has been posted, and you'll find with that email a summary of the key things that we talked about as well too, okay? Also in tomorrow's email, you'll have a link that you can sign up for next week's webinar, and keep in mind we have 3 more this month, all right? So we've got plenty going on, all right? All right, now, one other thing I wanna show you, if you're interested in getting more webinar time, I'm going to just do something to show you one of the things we're up to here. Let's see here. Oh, I got to do a screen share. Hold on. Let me show you. Okay, so many of you may know I'm launching a new membership community. And yes, it's going to be subscription based, but this is it. And one of the things I am using in my new community, we launch it for beta testing on Monday. There's an application process I'll show you if you want to be one of the people that is part of my beta group. And the beta group will be free for 60 days. But in my new community, this is an online community on the Circle platform. There are a few different spaces I'm having for people to communicate. And I'm going to be running a webinar in there called Ask Marty Ross MD Live. It's going to be different than the conversations with Marty Ross MD. And what's going to make it different is I'm going to host it on a Zoom room. And because it's on a Zoom room, I'm going to be able to interact live with people. I'm going to choose each week to do a visit that's going to focus primarily on 4 people. And I'm going to interview those 4 people. I'm going to have people submit their questions they want me to look at ahead of time. I'm going to pick 4 people to really focus on. And we're going to do a back and forth question and answer where I really get a sense of what's happening with them so that I can give them the best response possible. And in addition, in this forum, I'm going to ask community members that are attending to give ideas on what they think would help that person too. So we'll be developing community-based solutions. In the end, I will give an answer based on my question and answer of the person and input from community members. I'll tell the person what I think is going to be the best approach. Anyhow, this is going to be a deeper webinar than I'm able to do in conversations with Marty Ross MD. And I just wanted to make you all aware of that. There's other parts of this forum too. If you want to learn more about what we're doing here, take a look at my Treat Lyme page, look at my Lyme United page, where I talk about what is Lyme United. And then all the way down here is an application process. I talk to you about what's required to do this application, and then you apply. I'm actually picking the people that are going to be part of this. So take a look at this. So some of you may find benefit in my new community as well too. The beta phase is going to go on for about 30 to 60 days. And then I will be opening it up for non-beta members on a subscription plan as well, okay? So one more thing here, we go back. So anyhow, it's been really good being with you here tonight. I am very excited about this new Lyme United community. Many of you may find benefit from joining that as well. I am taking applications for the live launch as well, or for the full launch. So feel free to apply even if you don't want to be part of the beta group. I am picking people for the beta group tomorrow, actually. So if you are interested in that, get your application in tonight. And tomorrow morning, when you get the email from me, share it with anyone in your community who you think would benefit from what we're doing here as well, too. Oh, one last thing. I will always have conversations with Marty Ross MD, this webinar for free. All right. So don't worry, we're not going away. All right. All right. Good night, everyone.